how to make it? Okay, great.
Yes.
Yes.
All right, great. Well, actually, before I get started, I'll just introduce myself. I'm Autumn Patterson, and one of my coworkers, Brenda Taylor Moody, and we both
Hello.
Hello.
We both work for through the Alabama Department of Mental Health Employment Services Division. And so we have a service that we'd like to tell you all about that, we hope would be an asset for you now or even down the road. So I had actually talked with Bethany and Nicole earlier, and we talked about the way that this service that we have to offer is kind of structured, and that it might be a good idea to get the word out to you guys, the caregivers, and give you a chance to see what the service does, how we can help, and kind of digest it, and then present almost the same thing in a slightly different manner to the consumers tomorrow. So Brenda and I we're gonna just give you some information, and we definitely want to answer any questions you have and make sure that you all feel comfortable before this information is presented to the guys you care for. So I guess with that said, I think probably with the Zoom format, it may be best to hold questions. So I'm going to do the first basically half of this, and then we'll pause there for a minute before Brenda takes over. But the idea today is really to give you guys the general information. I know probably if you have thought about work, then you may have some specific questions, and we definitely want to answer those. The way that we go about, not to get too far ahead, but the way we go about answering specific questions based on an individual's exact situation is we get some verifications prior to that, just so that we know that we're working with all the correct information. So today it'll be kind of general, but by all means, we'll make sure that everybody knows how to get in touch with us so that we can talk with you one-on-one in the future about any questions you have.
Yes.
All right, y'all, and it's high noon in allergy season for me.
Oh, yeah.
So fighting through it today. So. All right, let's see here. All right. So I kind of alluded to this before, but like I said, Brenda and I both work through the Office of Employment Services Division of Developmental Disabilities with the Alabama Department of Mental Health. And, we do promote employment. We're not here to force it on anyone, and we don't get incentivized if we make anyone or try to make anyone, we would never do that, make anyone go to work. But we want to make sure that all these, every individual understands the opportunities that are out there and the support that they can access to gain employment and maintain employment.
Good.
So a little bit about our services. Like I mentioned, we do get a verification. So like, say if one of you wanted us to talk to one of your, with one of the consumers, then we have a referral process. I will make sure that if I haven't already, that Nicole and Bethany have that information so that they could refer people to us and that we could work with them one-on-one. But basically what we do after we get the verification to understand exactly which type of benefit the individual is receiving currently, we would look at how earnings affect their cash payment, their monthly check, waiver services, if that's involved, Medicaid, Medicare, and then any other federal, local, state benefits that they may be receiving, like food stamps or housing. And we don't just, our goal is not just to have someone become employed. We want to help them maintain employment, and that is by providing follow-up long-term assistance down the road. We're available for that individual. Once an individual is referred to us, They will have our direct phone number. You will have our direct phone number, and we'll be able to, you will work with us one-on-one, not another person or someone else in the office down the hall or anything like that. It'll be a, you know, a one-to-one relationship. We give, you know, we will talk through a counseling session. We give written benefit summary and analysis, or it's called What I Get, actually, the document we give. It just simply breaks down, here's the benefit you get, here's how much you want to earn or how much you are earning at your job, and here are the ways those earnings will affect your whole situation. And also another reason for the verification, as I alluded to, there are two different, many of you may know this already, so bear with me if I'm going over something you're completely aware of, but you know, there are two different, very different disability programs through Social Security. And the way earnings affect each of those benefits are completely and totally different. So someone who gets an SSI check, supplemental security income, their earnings have a completely different impact on their benefit than someone on this other program here, the Social Security Disability Insurance Program. So I'm going to talk a little bit more in depth about SSI, supplemental security income. And then when we stop here in the middle shortly, Brenda's going to pick up and talk about the Social Security Disability Insurance Program. Not 100% sure which benefit your family member receives. Some ways to know would be that for SSI, the maximum check is $841. So if your family member is getting a check for $841, they're very likely getting the full SSI. And a lot of times that happens, especially with people who become disabled early in life before they've had an opportunity to work and pay into the system. With SSI, the health insurance program that comes with that is Medicaid, and it's means tested, and you can never have more than $2,000 in the bank combined. Like if you have multiple accounts, the maximum that an individual on SSI can have available to them in a liquid type resource is $2,000. And then the SSDI program, Social Security Disability Insurance Program, you know, those checks can be much higher. They can go upwards in the $2,000 range. But sometimes even individuals who became disabled early in life can receive this SSDI benefit through what we call a childhood disability benefit. And then there are some other ways that you could get an SSDI benefit by way of a deceased spouse and things of that nature. You'll see Medicare is the primary health insurance program here, but there are ways that you could be receiving SSDI and on the Medicaid waiver service. So you'll see everything, unfortunately, is like in life. It's really not cut and dry. It gets pretty involved with people's situation. And so that's why we just try to be very careful to make sure we're fully clear and aware of exactly what is at hand before we start giving information and guidance, because the last thing we want to do is to give somebody information that hurts them in the long run. So we're very careful about that. So when Brenda and I broke this up, I really didn't think about it, but she really has the much more difficult program to explain. SSI is really kind of, it's pretty straightforward. These are the work incentives here, and I'm going to show you on the next slide sort of how these are applied. But and I'm just going to keep it real basic, as I said, though, because I'd rather just talk with you one-on-one if some of these more involved work incentives are at hand and applicable, because I'm afraid if we do it now in such a general with going in such a general like attack at it, that it's just going to get confusing. So but there are some, so basically, let me say this. So Social Security, anytime earnings are involved, anytime, Social Security is going to be interested in how much someone is earning gross before taxes and for the calendar month. Okay. So, and let's see, I'm not going to get too deep there, but that's what's important. So but we can look at, like, if an individual has a goal of earning, say, minimum wage, $7.25 to $8 an hour. I'll show you on the next slide, at 20 hours a week, we can work with that, come up with a very good estimate, and then be able to give you all and the individual very good information about exactly how that would affect their benefits. So, and that's for both programs though. It's always going to be about the gross earnings per month. So this may come across kind of small right now on your screens if you're seeing this, but I have emailed the presentation to Bethany, so she'll be able to send it out to you guys later. But basically, this is, as it says, it's a comparison. And so on the left, you'll see that this is someone who's getting the full SSI check. Okay, so they're getting $841. $841 is, we call it the full benefit rate, or Social Security calls it that. And that's the maximum a disabled individual can receive this year in 2022, earning while receiving SSI only. And so it's cut and dry. It's $841. That's what an individual would get every month. So the comparison, and the thing that we always try to really work with folks to understand is, let's look at this other side. So you'll see, and as it says up at the top, $7.25 an hour, we just did minimum wage and 20 hours a week just to use as a gauge, just to give you an idea of exactly how that might look if someone went to work at about that level. So this individual on the right, they are earning around $628 gross per month. And you'll see there's a general income exclusion of $20, an earned income exclusion of $65. Those are deducted. We're looking at the gross earnings here. And then that leaves a balance of $543. With this amount here, the $543, of that amount, Social Security is going to count against the individual's check $1 for every $2 they earn. So they count half of that against their check. We divide that 543 by 2, and you get $271.50. So we're going to hop down here, and you take that full SSI check, subtract the $271.50. Their adjusted SSI check is now going to be $569 or $570, basically. And that's where a lot of people might get concerned or back away. But what we really want to stress is when you add back in the earned income, the $628 to that $569, that's where we see the real benefit. And so that individual now has $1,198 to live on per month, as opposed to $841. So, there are a few like asterisks at this point, though. Of course, when we look at the $628 of earned income, that's gross. So yes, they're going to have taxes taken out of that. So they may not have $628 in their pocket at the end of each month from their job, but it's going to be very close to that. And the other benefit, just straight benefit for someone to work, is this is allowing them to pay into the system through FICA, Medicare, and other taxes. One thing, they're going to be contributing to their retirement fund for down the road. I mean, it will be a slow go at these low levels of employment, but it does contribute, it does add up, and it does count. And then, of course, the other thing is they'll be able to file taxes and get a tax refund and claim the earned income exclusion through taxes and, things like that. And they become more independent, of course, and have a sense of contribution into the community. So let me stop there, because that's the basics of the SSI. Now, let me say that if you look on up here above, like, well, I don't know that they're showing right now actually, but there's a couple of other work incentives that we can factor into this calculation on the right that could even further reduce the amount that's counted against the SSI check. And that's what I was referring to earlier, but that there's like an impairment related work expense, you know, so someone's having to pay someone to drive them to and from work because they're medically unable to drive themselves. That would be something we could count against those earnings and reduce the earnings for what Social Security is counting against their check. So, and that's not the only other work incentives. There's several others. And, you know, those are definitely things that we would explore every work incentive to make sure someone's able to take advantage of everything that is applicable for them. So do y'all have any questions about SSI or our service in general right now?
If
Also-
they are, oh, go ahead.
I was just gonna say I've muted everyone, so make sure to unmute yourself if you're trying to ask a question.
Autumn, if they are, you know, working, that $2,000 that they can have in the bank, that still applies, right? Like
It does, yeah.
so they
And
have to keep
that's
that
one-
in mind.
Yeah, absolutely keep that in mind. You know, and there's some work incentives or some services that we can let people know about. There's the ABLE account, there's pass accounts. And then, you know, I left this out, but we also offer like information and referral services. So even though Brenda and I or our other coworkers are not really trained on like, oh my goodness, like trust funds, you know, and things like that, we can get you in touch with people who can assist you like with attorneys or, oh my goodness, my brain, ADAP, you know, like folks that can work with people to establish families, you know, to work with the families to establish these trusts for down the road if that's a concern for you. You know, one of the real benefits of our service is that, like I said, it's one-on-one and you can basically come to us. We also work with the individual with reporting or with the payee, whomever it may be, to make sure that everybody fully understands the reporting responsibilities, what's the easiest, quickest way to do it. And then if you get a notice in the mail that is alarming, which happens frequently with Social Security, we help you look through, work through, understand that. And we have a liaison at Social Security who is amazing, who can help, you know, where we're trained, Brenda and I are trained and background checked, and we have to keep up continuing education credits. All this is directly through the Social Security Administration, but we act as like a buffer between the recipients, the beneficiaries, and Social Security so that we're in a safe place. We're not going to report anything on them. We just help them understand how to report directly to Social Security. So almost like an intermediary. So
I like that idea. So is there a way to work enough to actually move from SSI to the SSDI?
yes, there is definitely. I mean, you know, and I didn't say this earlier, but some people get both benefits. Some folks get a small SSDI check, but if that SSDI check alone is not over that federal benefit rate of $841, then SSI kicks in the rest. And so they're what we call a concurrent beneficiary. And so basically in that situation, all these SSI work incentives apply to their SSI part. And then all the benefits and work incentives Brenda's about to talk about apply to their SSDI check. You know, so that definitely does happen. And that would be what would be happening in the meantime as somebody is earning enough to eventually become entitled to that SSDI benefit.
Okay.
you know, and that's honestly though, now that like how much it would take or how long it would take to work, those would be definitely questions that Brenda and I couldn't necessarily answer. Those are more like questions for Social Security directly because they have all of that software that can, you know, generate that information and look at their past earnings and where they stand in terms of credits currently.
Okay.
Autumn, do you mind continuing the slide? For
Yeah,
me?
oh, sure. Yes, sure.
Because
Sure.
my internet might be a little unstable, so just in case.
Definitely. Glad to do it.
Look, only in Alabama where the wind blows do I lose internet service. And that's why I prefer the team approach in case I lose something. The second person is there. Autumn said something earlier that I want to reiterate. She said, we have a relationship with the client, the consumer. And that's the point. We have to get to know what our clients' goals are as far as working, if they want to pursue some type of educational or training. Those are all parts of benefits counseling. And that relationship does not immediately go away if the client says everything is good and we just don't hear from you. You could call us a year from now. We would just have to get some new release forms signed and we start again. It's a relationship. And we will check in after, you know, every few months just to make sure everything is going well. So I want you to keep that in mind, that we're on the side of what's best for the consumer and the parent. And so asking questions, I'm good with it. I actually prefer questions and I tend to run my mouth too much, so let's move on. So the SSDI work incentives, the ones at the top, trial work period and substantial gainful activity are two of the most important, because if these two things don't happen, then we don't have to go into extended period of eligibility or expedited reinstatement. And we can explain that in more detail if we have someone who's already passed the first two stages. The trial work period is 9 months. And this is where someone on SSDI can make any amount of money that they want without it affecting their SSDI check. And how can I say it? I won't say because I don't know all of the ins and outs, but I've told client goes, I'm going to make $1,200. That's more than my SSDI check. Am I going to lose my check? No, you're not. Now, with that $1,200, they have made over substantial gainful activity, which for 2022, it is 970, I believe. Is that correct, Autumn? You're on mute, girl.
SGA for 2022 is 1350.
1350 in the trial work period month.
Oh, I'm sorry, trial work period, 970.
Yeah.
I'm
970.
off.
So if that person made more than 970 during that month, it would count as one of their 9 trial work months. And if they made 1,200, it would not be considered substantial gainful activity because that number for 2022 is 1320. Yeah.
1350.
1350. It tells you how numbers in our work. I have to look it up all the time. So this is a safety net that allows consumers to try working without fear of losing their benefits. And the trial work period doesn't have to be 9 consecutive months. It doesn't have to be January through September or it can be 3 months in 2021 and 4 months in 2022. Nothing has to go hand in hand. Okay. And we would discuss if these things have happened, the person has met their 9 months, and Social Security determines that they have been working at a substantially gainful level. We don't get to make that decision. Social Security makes it. Then they would go into what you call extended period of eligibility, which means they still keep their insurance. Still keep it. And this is for up to 36 months after the last date. And I'm going to stop right there because it gets really intensive after that. That's why we have to sit down with each person. Next slide, please. Okay, who's eligible? Anybody who is currently receiving SSI or SSDI or both. Well, SSDI, SSI and SSDI. The ages from 14 to retirement. If you're on one of the waivers, the intellectual disabilities, the living at home, and the new one, the community waiver program. Now, if you'd been on a waiting list for one of the other two, ID or LAH, you can also ask for a referral. Next slide, please. Okay, when? I like to say anytime that work has crossed your mind. If you're currently working, if you're considering work, if you're returning to work. But the truth is, with this being a free service, if it's something that you see in the future, a couple months down the road, or your loved one is talking about, I want to do something. I want to do something to be productive. Now's the time for the referral. And as you can see, actively seeking or job offer. It doesn't mean they have to go to work. We encourage work, but the decision is ultimately between you and your loved one and what is best for you. And it does not hurt to have a little extra information in case you're on the fence. We give you the information, you make the decision. We're just here to help you through some of the more difficult language, which Autumn helps me with on a regular basis. She's done it a lot longer than I have. Next slide. Okay, these are the key points. Think of a tree with two giant branches. SSI and SSDI are treated very differently, okay? In most cases, and we stress most, that you can work and keep some or all of your benefits. That includes the insurance and waivers because people are very concerned about those services, and you should be. It's taken a while to get SSDI services. For a lot of people, you have to wait 2 years, to get your Medicare. So just remember, you can keep those. It's possible to work and see almost every case, we're moving on. And it is possible to work and come out ahead. That little chart that Autumn went over with you, that happens in almost every case. It's possible to work and come out ahead. And even if benefits are lost due to work, it's possible to get those benefits back. When we talked about that expedited and extended. So if you lost your Medicare based on working during that time after the trial work period, boom, we call Social Security and you're still, you don't have to start the application all over again. You're already there. Next. Okay, and it's a simple process. Autumn is going to send the referral form, and at the bottom of that form is going to be that email address that you see. You complete this form, You get the releases signed, which kind of speeds up the process so we're not emailing back and forth or mailing back and forth. And then all of those forms get sent to the benefits counseling. Before, this had to go through a couple of other steps. Now it's more streamlined, and so it moves a little faster. And here's our CWIC contact list. And you see Autumn and I are at the bottom. We actually split a couple of counties. Anybody can contact us, and either one of these people will direct you to the one closest to you and who can handle it for you. And I just want to say thank you. I've learned some things once Autumn told me who we would be presenting to today. I did a little research, so I've learned some things. Thank you. Is that it?
Oh, you're muted, Autumn.
Sorry. Yeah, that's the end of the presentation, but we're happy to answer any other questions if there are any.
Hi, everyone. My name is Bethany, and I am our caregiver programs coordinator for the Alabama Head Injury Foundation. And I just wanted to take a couple of minutes at the end of this presentation to kind of give you a little bit more information that was discussed at the end of this presentation that was not recorded. So I wanted to go over some questions that were asked and just some additional information. So the first thing a couple of caregivers were asking was, can you make a self-referral? The answer is yes. So if you guys are interested in just getting the information from this presentation today and referring yourself, go ahead and do that. You do not need an outside source to make that referral for you. Another question that was asked was, are there limitations to who they, which is the benefits counselors, will help depending on the disability? And the answer is no. They are willing to help anyone, work with anyone. So there is not a certain like deficit that you need to be at in order to receive this benefit and work with these counselors. Some other things that they went over was that they are focused on the financial outcome for all, that they do help with other Social Security and Social Security disability information as well. So if that is something that you are interested in, if you have lots of questions, you're not sure who to ask, feel free to take their contact information and reach out to them. And additionally, after working with the benefits counselor, their next step is going to be to connect you with the resource that you will work with to find the job that you are looking for. So that's not, their job is to help you to get to that place of working. And then they will find the resource that will help you get the job, depending on if there's a specific job you're wanting, or you just want to start to figure out what options are available for you. And additionally, I just wanted to say that if you have any questions for us about this presentation, please feel free to email us at caregiver@ahif.org. I would love to answer any questions you have or get you connected with any other additional resources that may benefit you guys. So just thank you so much for taking the time to watch this presentation today, and I look forward to receiving any questions that you may have. I hope you have a great day.